A new report released by the Canadian Diabetes Association entitled Diabetes Canada at the Tipping Point, Charting a New Path, indicates that while some progress has been made by government over the past 5 years to address diabetes, this progress is dwarfed by the growing burden of this disease. The report strongly recommends that Canada take immediate action to tip the course of diabetes in the country to curb this growing burden. Michael Cloutier, President and CEO of the Canadian Diabetes Association, says changes need to be made to address this growing epidemic.
This report demonstrates that we're at a tipping point related to diabetes here in Canada, and that the economic burden created threatens the very sustainability of our healthcare system. Canadians are also very concerned. They are concerned about the impact for their families directly and, of course, the system at large. In fact, 41% of Canadian parents recently surveyed believe that their children, or children they intend to have in the future, are at risk of developing type 2 diabetes.
Unless action is taken now, 1 in 3 people will be living with diabetes or pre-diabetes by the end of this decade. Today, diabetes costs our healthcare system and economy $11.7 billion. By 2020, this will grow to $16 billion annually if trends continue. Diabetes advocate Sean Shepherd is calling for action today on behalf of all Canadians living with diabetes.
Right now, access to diabetes medications, supplies, services, devices, education, and programs vary greatly depending on where you live in Canada, and that's of great concern to all Canadians living with diabetes. The biggest obstacle for somebody like me living with diabetes is the fear of the major complications that I might be facing. Not only that, but the discrimination that we face of living with diabetes, and of course, the financial burden that we all live with.
In comparison to peer countries, Canada has a higher rate of diabetes prevalence, hospitalization, and mortality. Certain populations carry a heavier diabetes burden: Aboriginal peoples, new Canadians, and low-income Canadians. Women across these populations bear a disproportionate burden from the disease.
To tip the course of diabetes in Canada and to chart a new path, we need to focus on 3 things. The first is to reduce the burden of the disease. The second is to ensure that we are enhancing the quality of care for people living with diabetes. And the third is to ensure the government are making strategic investments into diabetes care and research. Unlike other chronic diseases, we know that diabetes can be effectively managed. We know that we can help Canadians live healthy and productive lives. We know what to do, we know how to do it. We just need to do it.
For more information about diabetes, as well as diabetes management and education, or to view a copy of the report, visit diabetes.ca. Sherry Demeturco reporting.